everyone. My name is Khalid Siddiq. I am a dermatologist. Today, I will present a pilot feasibility study titled Artificial Intelligence in Mobile Health for Skin Cancer Diagnostic at Home. AIM High. This study explores the potential of using an AI-based mobile app for skin cancer detection in primary care. The AIM High study was led by a team of experts in dermatology, public health, and health care management. The key authors include Anna Smart, Groger Toback, Sangers, who focus on AI skin cancer detection, and just AH Eklof, who work on health care innovation in primary care at leading universities. The team collaborate approach highlights the potential of AI to improve skin cancer diagnostic in both primary care and broader health care settings. Background. As many of you know, GB are increasing being consulted for skin lesions, the majority of which turn out to be benign. Unfortunately, diagnosing skin malignancy can be quite challenging for GB, which lead to unnecessary referral to specialists for benign lesion and sometimes late detection of actual skin cancer. Over the past few years, AI-based mobile health apps have emerged as potential tools for diagnosing skin cancer. This study aims to assess how feasible it to implant such an app in real-world primary care setting. The study objective. The primary objective of this study was to evaluate whether the implantation of an AI-based M health app is feasible in primary care, especially. It looked at two settings. First, when patients use the app at home before visiting their GP. And second, when GP use the app as a diagnostic aid during consultation. Study design. This was pilot feasibility study conducted from November 2021 to June 2022 in three GB practice located at Rotterdam, Leiden, and Katwijk in the Netherlands. The study used a mixed method design, combining both quantitative and qualitative data. The app tested in the study is called Skin Vision, which use AI to classify skin lesion as high or low risk. Study procedure. The study involves two phases. In phase one, patients use the M Health app before their GB visit and filled out a questionnaire on how the app results affected their decision to visit the GB. In phase two, the GB assessed the patient without knowing the app result and provided their working diagnosis and treatment plan. After this, the GB reviews the app findings. The app accuracy was cross-checked using pathology report or teledermatology assessment. Study population. The study includes 50 patients with a median age of 52 years. 64% of the participants were female, and 90% of patients reported have a light skin type. Most lesions were located on the head, neck, and chest, and two-thirds of patients noticed change in the lesion, such as itching or size change. Patient participation. In terms of patient participation, 71.4% of eligible patients agreed to participate. Of these, 84 successfully completed the study. One of the interesting findings was that only 44% of the patients were able to use the app independently. Nearly half of the participants need assistance from the researcher or family member to use the app. GB participation. 90% of the GB completed the study successfully. Although the app did not lead GB to change their initial working diagnosis, it did influence their treatment plan in 5 cases, for example. In some cases, the app promoted GB to opt for more aggressive treatment or referral. Diagnostic accuracy. In terms of accuracy, the app performed well. It has sensitivity of 90.9% for detecting malignant lesions, meaning it correctly identifies the majority of high-risk cases. Specifically for benign lesion was 80%, meaning it also did well in identifying low-risk cases. Interestingly, the GB diagnostic accuracy remained constant, and they identified 80% of both benign and malignant cases. The impact of the app on patient behavior. One particular noteworthy finding is that 54% of patients who receive a low risk rating for a benign lesion said they would have canceled their GB visit if they had known this beforehand. This demonstrates the potential of AI apps like this to reduce unnecessary GB visits for benign skin lesions. Qualitative findings and barriers. The study also collected qualitative data to better understand the challenge involved. Several barriers were identified, include time pressure for GB, a lack of dedicated space for the study, and difficulty with app usability. Some patients have trouble using the app, particularly if the lesion was in the hard to reach area if they have lacked technology experience. Another barrier was the influence of the researchers themselves on the process. In some cases, patients may have behaved differently because they were being observed. Qualitative finding facilitators. On the other hand, there were several facilitators that improved participation. The presence of researchers often helped ensure that data was collected properly and that patients used the app correctly. When patients were more comfortable with technology, they found the app easier to use. Finally, having well-informed GB and patient about the study also helped smooth the process. Implication. So what are the implications of this study? The preliminary results suggest that AI-based M-Health app like Skin Vision could potentially reduce the workload on GB by minimizing unnecessary visits for benign skin lesions. However, the study did not show any significant impact on the diagnostic accuracy of GB themselves. Moving forward, larger study with more diverse population will be needed to determine the app's full potential, particularly in assessing safety and scalability. Study limitation. The study does have some limitation. First, the sample size was relatively small and not representative of a broader population, as 90% of population of participants have light skin type. This raised concern about the generalizability of the results to more diverse groups. Additionally, almost half of the participants require assistance in use the app, which limits its particular as a stand-alone diagnostic tool. At conclusion, the AIM High study suggests that it is feasibility to implement an AI-based mHealth app in primary care for triaging suspicious skin lesions. The app could potentially reduce the number of benign lesions that GP need to assess in person. However, large studies are needed to further validate these findings and explore how to improve app uh, usability. Thank you very much for your attention.